This week we will be talking about neuropsychological testing as well as the BDI and BAI. So neuropsychological testing is not something that MFTs would engage in. You would have to have a license as a psychology or be under the supervision of someone who is a licensed psychologist. But it's really important to be aware of these types of tests, especially if you're working with someone who's gone through some type of brain injury or some type of infection that's affected their different areas in their brain, which in turn affects their behavior and their personality. So it's interesting, but it's a lot about the brain. And so if you're into all that stuff, this is a really interesting section for you. The BDI and the BAI, on the other hand, are absolutely tests that you may use as MFTs in your practice. So they're brief instruments that review depression and anxiety. So it's Beck's depression inventory and Beck's anxiety inventory. I've used these several times in my past. It's a really good place to start with a client, especially if they are exhibiting depressive symptoms or symptoms of anxiety. It'll give you a lot of insight on how severe it is. So I have provided several examples of neuropsychological testing interventions, such as like the clock drawing, also the actual BAI and BDI instruments themselves. So enjoy it. I would save all of this stuff, like I always recommend. Just you never know what's going to come up in your future practice. So as always, enjoy the material. Make sure to do the reading just so you have a solid grasp of what these tests entail. And I'm here for any questions or concerns.